What should be the ideal distance when you are doing sensory examination for hand and fingers? Hello everyone and welcome back to my channel Physiotrendz. This is me Physio Trendz, and in today's video we are going to discuss about sensory examination for hand and fingers. And for that the test which we use is called as Weber's test or Moberg's test. Yes my dear friends, normally to check for the sensory examination we have to use a stereometer, but let's say if it is not available with you, we can also use a U-pin in such a way that we can bend the U-pin, and after that we can form 2 points in such a way that we can measure the 2-point discrimination with it. So initially we measure the distance of 15 mm to identify whether person is able to distinguish between 2 points or not. And later on we reduce the distance to find out what is the accurate result for the patient. Now let's learn how to start the test. To start the test, first of all patient has to be in comfortable position. After that, whichever side is good, whichever side is unaffected, that side we test it first. For that the instruction to the patient should be given like patient has to close the eye, and after that patient has to identify how many points they can feel when we are asking them. So let's just take a small demo. Let's suppose that right side is normal, left side is affected. On the right side, therapist is going to place 2 points. This is a distance of 15 mm which I have already measured. I'm going to place it from proximal to distal. Let's say I'm going from this area to this area. And you have to make sure, again one more thing what you have to make sure is patient's hand has to be placed completely rested and no other body parts of therapist should be touching the patient's hand. Okay, so let's say it is completely rested now. From proximal to distal, I'll be putting these 2 points, and then we can ask patient whether how many points they can feel. If they are able to identify 2 points are there, then we can decrease the distance, and that is for the normal side first. After that we will be doing it for the affected side. Same procedure, patient with closed eye, comfortable position, no other body parts touching to the patient's hand, and then we place this 2 points with 15 mm starting, and then we identify from proximal to distal how many points they can identify. If they are able to identify 2 points, then we reduce the distance. Ideally 6 mm or less is the good distance that patient should be able to differentiate. If it is between 6 to 10, we consider it as a fair. If it is 10 to 15, we consider it as poor. I really hope you understood how to do this sensory examination for hand and fingers, and if you still have any doubts, you can ask me in the comment section. And if you want to learn more like this test and as well as science for diagnosis purpose, you can check out the Physiotrendz YouTube channel. Links are provided in the description.